Hi, everyone. I'm Maggie McGrath, editor of Forbes Women. The 10th annual list of the Forbes Next Billion-Dollar Startups is out now, and on this list is a healthcare company aiming to help patients with eating disorders. That company is called Equip, and we are joined by their two co-founders today, Kristina Saffran and Dr. Erin Parks. Thank you both so much for being here.
Thanks for having us.
Now, there's a study from Harvard that indicates that eating disorders and the unpaid caregiving, the lost productivity, and the treatments add up to a $65 billion economic cost every year. But Kristina, your experience with eating disorders and the eating disorder industry, if I may, is very personal. You've joked that you've been in eating disorders all your life. Can you kind of explain what that means and how you got to this role?
Yeah. So I was diagnosed with anorexia at 10 years old, which is young, but unfortunately not that rare. We treat 5-year-olds here at Equip. I talk about the fact that I had a whole lot of privilege, good insurance, a family that could afford to pay the lots of money out of pocket, and perhaps most notably, I fit that stereotype of what we think eating disorders look like. They actually don't have a look. They don't discriminate. They affect everybody. But even with all that privilege, I had a pretty horrific treatment experience, which is really the norm for folks with eating disorders. So I spent my entire freshman year of high school, not in high school, in and out of 4 different hospitals for a total of 7 months. When I got out and inevitably started to decline into my disorder, because I didn't know how to take care of myself, nor did my family, doctors said to my parents, send her to a long-term facility across the country and don't hope for recovery, because people don't recover from eating disorders. And I'm really grateful that they didn't listen to that and instead dove into the research. This was 2 decades ago. They learned about family-based treatment, which we now know is the leading evidence-based treatment for kids and adolescents, that at a high level understands that these disorders make you fight your brain upwards of 6 times a day. It's not only ineffective, but kind of cruel to ask people to do that alone. And so it empowers the healthy people in the household to structure the home for pro-health behaviors. That was my road to recovery, but quickly learned how just grossly inequitable and inaccessible the eating disorder field is, with 80% of the 30 million Americans who struggle not able to get treatment.
Say that one more time. What percent of the 30 million Americans with eating disorders can't get treatment?
80% of the 30 million Americans who struggle don't get treatment.
So we'll bring Erin into this in just a second, but can you give us an overview of what Equip is and how the treatment is different than the traditional options?
Yeah, so 80% of the 30 million Americans don't get treatment. An even smaller fraction have access to evidence-based treatments that result in lasting recovery. And so that's what Equip is designed to do. It is really to ensure that every person with an eating disorder has access to care that works and that results in lasting recovery. Every patient who comes to us gets matched with a multidisciplinary care team comprised of a therapist, a dietitian, a med provider, and we have mentors, peers and family members who've been there, who have lived experience, and who help you go through the process. These are all employees of Equip, and we invest tremendously in training and supervising them in the evidence-based treatments for eating disorders and also the comorbidities, because eating disorders never occur alone. And then we've worked with insurance companies to cover a year or more of access to this treatment, really enabling folks to get to that place of a strong and lasting recovery.
We'll get to the insurance companies, but just to connect the dots, Kristina, you had started a nonprofit. You were on our 30 under 30 list, but you realized that Equip was the better solution. What year did you launch?
We launched in December of 2019 on this idea, a piece of paper.
Then on a piece of paper. Erin, when did you enter this journey? What attracted you to the opportunity?
Kristina and I met, I think, 2014, 2015, and we'd see each other at eating disorder conferences where the academics, which I'm one of, would sit and discuss and debate little tiny nitpicky ideas. And we wanted to think bigger. How could we help more people? What was keeping evidence-based treatment stuck in academia, and how could we disseminate it so everyone had access to it, even if you didn't live next to a major academic hospital. And so, in 2019, we started talking that maybe nonprofit wasn't the fastest or most capitalized way to help everyone, and academia was certainly not the fastest. And so we thought, let's do something unique. Let's go use some venture capital and have some money to try something new.
And Erin was one of the co-directors at one of the leading eating disorder research and treatment folks in the country, where folks would literally fly from all over the country and all over the world to get treatment. And both of us bonded over the fact that that's ridiculous. You shouldn't have to fly across the country to get treatment that works. How can we bring it to you and keep you in your community, in your family?
That's interesting. So Katie Jennings, our healthcare reporter, has a great story that goes really in depth on Equip and everything that you're building. And she has an anecdote from a parent who says they were terrified to have their child in inpatient treatment. Erin, in your experience, how common is that reaction, and how does Equip provide a different solution?
Yes. So right now, a lot of people think if you're struggling with an eating disorder, you need to go away for treatment. You need to be separate from your family. And there really is not a lot of data to suggest that it works very well, and it shouldn't be first-line treatment, because eventually you're going to return home and your triggers are going to be there, and your family, whether that be your biological family or if you're an adult, your chosen family, need to be there to support you. And so what we want is to help families be able to stay together, but also adults. For adults with eating disorders, it's not realistic to take 2 months off work, to take 2 months off parenting and go someplace else to get better. You should be able to get better in your own home. And we have about 20 years of data to suggest that it's really effective. We're disseminating the evidence-based treatment that allows people to get better.
One of the things we're really proud of to that point is that 80% of folks who join us here at Equip had been eligible for that residential level of care, what I was recommended at 13, where you go away based on their clinical presentation. We end up sending about 3% to a residential facility. And so the majority of folks are able to get better. It is really, really hard treatment, but work with their care team, work with their support system, and get better at home.
So let's actually go through a hypothetical but realistic use case for Equip. So I am a parent. My child is exhibiting signs of an eating disorder and/or has been diagnosed by their primary care physician. I do not want to send them to an inpatient facility. I'm looking for other options. I find Equip online. And what happens next?
So a parent or their pediatrician would reach out to Equip, and we would connect you with care right away. One of the problems in the eating disorder field is a lot of people have wait lists, 1 month, 3 month, 6 month wait lists. And when your child is sick, you want treatment today, not 3 months from now. So we get you connected right away with services. What that will look like is you'll be assigned this care team, and via video sessions, you will meet with your providers. You also will have the ability to message your providers in between sessions. You'll also have the ability to attend groups, take classes, and be surrounded by people that are able to help you get your child better. It's really about empowering the family to make pro-health decisions. Just to kind of do a little bit of an analogy, if you thought that your 15-year-old was struggling with substance use, when your 15-year-old goes to soccer practice, you would search their room for substances and dispose of them. You try to make it difficult for your child to drink alcohol or use drugs. Same thing is true if your child's having eating disorder urges. You're going to set up the home to make it difficult for them to act on their urges. So if your child is struggling with purging behaviors, you might say, hey, as a family, after mealtime, you can have unlimited screen time, but I have to keep eyes on you. You can't go to the bathroom alone. You can't go take a shower immediately after a meal. So that's an example of setting up the home for pro-health behaviors. And so what the Equip providers do via one-on-one sessions, group settings, messages, however you want to receive the support, is teach you these different skills to empower you, help you feel confident as a parent that you're going to help your loved one get better.
I should also point out that we do differentiate between inpatient and residential treatment, which is really what we're talking about. So eating disorders have the second highest mortality rate of all mental illnesses, second only to opioid use disorder. Some folks do need to be in an inpatient hospitalization for a limited amount of time if their heart rates are in the 30s or 40s, if they are at risk of cardiac arrest. That is not a level of care that we replace, and we work very, very closely with local inpatient facilities. But many folks, upwards of 50%, are discharging straight from that short inpatient stay to treatment at a clinic.
Interesting.
Yeah, I think something that comes up, though, is kind of why virtual, right? And want to talk about how virtual is a little bit different than going to brick and mortar. And it's great because where life happens is in your house, and virtual is able to come into your house with you. And so we're able to watch meal times and see the fight happen in real time. We're able to have them pick up the laptop or their phone and show us their pantry, show us their fridge, talk about cooking. We're able to meet with someone before soccer practice. They can call in from the sideline and eat their pre-practice snack with their peer mentor or their dietitian before they go and have their practice. And so by being virtual, it's not just taking the treatment that used to be delivered in brick and mortar and throwing it online. It's about using this technology to work around people's schedules, to meet people where they're at, to know that some people eat in their car before work, that some people are having a snack with a school nurse in the middle of the day, that some people are eating on the sideline at halftime. We can be there with you through all of these different activities.
Yeah, we talk a lot about the ability to help folks build a life worth living while they're living life. You can't do that when you're out of your life in a facility. And as I mentioned, eating disorders require you to fight your brain many times per day. And so the whole idea is, how do we give you that support in the moment when you need it? Whether, as Erin mentioned, that means a 5-minute check-in with your nutritionist before you're going to play soccer, or a series of text messages with your peer mentor when you're in a really stressful situation, but not overdose you on treatment that you don't need. We want to empower you to go out and build that life worth living.
Now, you mentioned earlier that a capital-backed startup is a more effective way to treat more people versus a nonprofit. So, a question for you both, or maybe Kristina can go first. What has it been like taking Equip in front of Silicon Valley? And what's been the reaction from the investor class? Because sometimes healthcare startups, if you don't have a person in the room who's experienced that condition which you are trying to address, you get blank stares or otherwise dismissed. What has your experience fundraising been like?
I think we learned very quickly that all venture capital is not created equal. And so we certainly had some pretty cringe moments as female founders in a healthcare space, in a very male-dominated, tech-dominated industry. And we also had some pretty amazing experiences with investors who really understood healthcare, really understood the problem that we were solving, and candidly ended up with a board of some of the most mission-driven investors. Every person around the table has some direct experience with the problem. And we've always found that this team is mission first. Of course, they want to make a profit, and that will come as we achieve the mission. But this team cares above all about us helping as many people as possible with high quality care.
I think something that was interesting about us going out and fundraising is it really proved our point that eating disorders affect everyone. When we talk about 80% not getting treatment, a huge part of that is that 80%, a lot of them aren't getting diagnosed. We don't diagnose men. We don't diagnose people in fat bodies. We don't diagnose BIPOC people with eating disorders the same way we do thin white women. Those are the people who are getting diagnosed. But in fact, eating disorders affect everyone. At Equip right now, we have a 4-year-old with ARFID and a 60-year-old with bulimia, and every age in between, because there are 7 different types of eating disorders. And so when we went out fundraising, I would say 80% of the time, we weren't even halfway through and someone would be like, that's my son, that's my nephew, that was me, that's my cousin, that's my daughter. It was hard to get through a pitch without someone talking about how an eating disorder had affected them. And it just really proved our point that eating disorders are everywhere, affecting everyone.
I just got goosebumps. That must have been an emotional process too, hearing those stories. But you've raised $110 million as of this date. Is that correct?
Correct.
And Talk to me about how you make your money. Who pays you? Is it the family or is it the insurance providers?
Yeah, we're really proud of the fact that about 98% of our revenue comes from insurance providers. We're in network with over 25 different health plans. Over 110 million Americans have full access to in-network benefits through full coverage through their in-network benefits for a year of EQIP or more. And that was core from the very beginning. I mean, access is really one of our North Stars. We didn't want families to have to pay out of pocket. And while we're so proud of the traction that we've had with insurance companies, we also are working every single day to expand that coverage such that every American has full access to this coverage.
You talk about wanting to expand that coverage. What is the conversation with the insurance industry like? Is it like pulling teeth to get them to come on board, or do they see the financial opportunity and the human opportunity?
Just like I said, all VCs are not created equal. All insurance companies are not created equal, as you can imagine. But I will say, we've had some tremendous partnerships, and I really describe them as true partnerships. We were very fortunate from the beginning of EQIP. I mentioned that we raised our seed funding on this idea in December of 2019. One of the catalysts for that was that we had become friendly with the chief medical officer, the former chief medical officer of Optum Behavioral Health, one of the largest insurance providers in the country, who we had a meeting with back when we were in academia, a nonprofit, to talk about how do we build a better model of outpatient care. You're spending a lot of money on these residential facilities that don't work. And there's evidence-based treatment that does work, but it's stuck in a handful of academic centers across the country and really not accessible. And he essentially said to us, "You're right. And if you build it, I will buy it. This makes a whole lot of sense to me." And so that's how we got our marching orders. And I think being able to prove out with UnitedHealthcare that this model really worked helped other insurance companies to come into the fold and say, yeah, I get it. It was also COVID. And so you had eating disorders rising, like all youth mental health issues. And you also had the acceptability of virtual health rising at the same time. And so we definitely had some pretty significant tailwinds at our back. The thing that's been perhaps most exciting to me is on Medicaid. So those were the conversations where 5 years ago we went into them and it was like pulling teeth. They would just roll their eyes at us and say, not our population, not our problem. And it's been incredible, basically a 180-degree reversal where now they are coming to the table. They are reaching out to us proactively saying, we know this is a problem in our population. We actually know that as food insecurity rises in a community, eating disorders directly rise and are coming to the table proactively looking for solutions.
Wow. So how many patients have you helped to date as of now?
We are over 5,000 patients have been treated with EQIP, and most patients don't come alone. We encourage them to bring, certainly for the under 18, bring their family. And that's not just parents, it's step-parents and grandparents and siblings. And for adults, whatever family is to you. So we've met college roommates and coaches and siblings and aunts and uncles and best friends. So we've helped, and we like to think we helped at least over 15,000. When you help an individual, you help their family, but 5,000 patients have been treated.
Which we're so proud of that. Oh, I was going to say, it's the things that we talk about a lot. We're so proud. 5,000 patients makes us one of the largest eating disorder treatment providers in the country. But that's also kind of horrifying. Like, there are 5 million people today, right now, who need help. Someone dies every 52 minutes of an eating disorder. It's kind of a drop in the bucket in terms of the overall need for this type of treatment.
And this goes back to our strong collaboration with payers. We have such aligned incentives. People with eating disorders, at least 50% are struggling with moderate to severe suicide ideation. These are people who frequently need to use emergency care, urgent care, and have a host of other physical and mental health illnesses that come from just having an untreated eating disorder for so long. And so we are able to both bring joy back to people's life through helping them find recovery and also have them stop utilizing the medical system as much.
Okay, so I have two follow-up questions based on what you both said, and the first gets to recovery. What does recovery or success look like? Is it, I don't want to use the word cure because I imagine this is a lifelong condition for a lot of people, as is mental health, right? I've been in therapy for years and I will continue to be in therapy for years. But so let's start with that first question. What does success and or recovery look like for your patients? How do you measure it?
Such a wonderful question. Let's piggyback off of one another because it's been a question we've been having internally and as a field for many, many years. The reality is the field has not defined recovery, which is a really cool opportunity for Equip to do just that. What we look at for our patients is a combination of eating disorder symptom reduction, comorbid symptom reduction, that depression, that anxiety, that OCD, that PTSD. For our patients who are on weight gain, that's a critical metric because we know that you can't get to a place of recovery when your brain and body are undernourished. They're not going to be working properly. And then reduction in readmission to higher level of care, to other higher level eating disorder treatment, and of course, quality of life improvement. That's a whole lot of things, and that's just kind of a fraction of the metrics that we can look at. But ultimately, what Erin and I talk about, and as somebody in recovery, what I really care about is pretty simple. On a scale of 1 to 10, 1 being never, 10 being every single waking hour, how much brain space is taken up thinking about food and thinking about your body? And that's ultimately what we want to try to impact. We want you to have brain space for much more important and joyful things than your eating disorder.
When we're working with the parents, we ask parents what matters the most to you. So especially for our parents whose kids have ARFID, they say, we can go on vacation. We can eat out. We aren't confined to our home where it's the only place with safe food for our kids. And then the other measure parents care about is a measure of confidence. I feel confident that I can help my kid. I feel confident that I'll know a blip before it becomes a relapse. And those are the things that matter a lot to parents, is feeling like they can exhale.
My second follow-up question based on what you had been talking about earlier, 5,000 patients is incredible, but you said it's a drop in the bucket compared to the 5 million. What is going to be the key for Equip and maybe the industry at large, but let's just focus on Equip, in treating more patients? What will fuel your growth? What do you need in order to reach more people?
The investment that we got in our Series C last summer allowed us to launch to treat adults. So we officially opened our doors to adults in around September of 2023. And by treating adults, it means we're treating a really wide variety of people. So I mentioned our youngest patient is 4, and then we have patients at all stages of adulthood who also have a lot of different comorbidities. What we want to make sure is that when you come to Equip, you feel safe to get treatment. You feel like people understand you. Because this is a field that has really been designed for thin white women, full of providers who are thin white women, we understand why it's hard for a man in their 40s who's a professional in finance to come and seek treatment. There's many patients like that here now, but one said to us, like, I wanted to go to treatment for 20 years, but it's never been appropriate for me to sit in a room with a bunch of 20-year-old girls. And he's also like, now I have a job that would not allow me to go, take a break from my job. And so really what we're doing now is investing in making sure that whoever comes to Equip feels safe. You mentioned that mental health treatment is really a lifelong thing. That's all taking care of our mental health, because there is no health without mental health. We want it to be such a great experience that if in the future you struggle, you have grief, someone that you love dies, in the future you go through a divorce, in the future you experience depression, that you feel safe and comfortable seeking mental health care again.
We're down to our final minute, so I will ask for a prediction. If I were to speak with you 1 year from now, what do you hope to be able to tell me that Equip has accomplished in that time?
I hope that we have doubled the number of patients that we've been able to help, that we've significantly increased our insurance coverage from 110 million Americans to many more, particularly excited around the Medicaid book of business and that population. And to Erin's last point around really needing to change the stereotype of who we think gets an eating disorder, that we've made a significant cultural dent in helping people to understand that eating disorders don't discriminate and that they affect everybody.
Well, Kristina and Erin, I hope to be able to have that conversation with you 1 year from now and to hear that you've reached those accomplishments and to hear where the industry is at that point in time. And in the meantime, thank you so much for your time. We so appreciate it.
Thank you so much.